Hello and welcome, dear students. Today we are going to discuss about the topic genetic counseling. The main objectives of today's lecture are to know the basics of genetic counseling, to know the history of genetic counseling, to discuss the structure of genetic counseling, to discuss the subspecialties of genetic counseling, to discuss about the hereditary cancer genetics, and finally to understand the scope of genetic counseling. Dear students, let's start with the introduction first. Genetic counseling refers to guidance relating to genetic disorders or problems that a specialized healthcare professional considered as genetic counselor provides to an individual or family. A genetic counselor might provide information about how a genetic condition or a disease could affect an individual or family, or interpret genetic tests designed to help estimate the risk of a disease in the family. The genetic counselor conveys information to address the concerns of the individual or family. Genetic counselor helps them make an informed decision about their medical situation and provides psychological counseling to help them adapt to their condition or risk. As members of a healthcare team, genetic counselors provide information and support to families affected by or at risk for a genetic disorder. They serve as a central resource of information about genetic disorders for other healthcare professionals, patients, and general public. In general, a genetic counseling session aims to increase the family's understanding of a genetic condition or disease, discuss options regarding disease management and the risks and benefits of further testing and other options. Genetic counseling helps the individual and family to identify the psychosocial tools required to cope with potential outcomes. Also, reduce the family's anxiety. It also is not unusual for multiple genetic counseling sessions to occur, and at a minimum to include a pre-testing and post-testing session. During the initial genetic counseling visit, the genetic counselor will determine why the patient or family is seeking genetic counseling and identify what information they wish to obtain from the session, collect and record a family medical history, and assess and record the medical and psychosocial history of the patient. Among the topics that may be discussed during a pre-testing session are the clinical presentation of the condition the patient may be at risk for, pattern of genetic inheritance of the condition, chance of recurrence, available testing procedures and test limitations, reproductive options, and follow-up procedures if needed. General questions relating to suggested treatment or therapy are also addressed. Referrals may be made to specialists regarding specific issues that fall outside the scope of genetic counseling practice. If the patient decides to have genetic testing performed, the genetic counselor often acts as the point person to communicate the results. However, the post-test session involves more than the provision of medical information and often focuses on helping families cope with the emotional, psychological, medical, social, and economic consequences of the test results. In particular, psychological issues such as denial, anxiety, anger, grief, guilt, or blame are addressed, and when necessary, referrals for in-depth psychosocial counseling are offered. Information about community resources and support groups can be provided to the patient or family. If the genetic test is positive, testing may be considered for additional relatives of the individual. Genetic counseling referrals for other family members for risk assessment may be discussed. It may be necessary to refer relatives to other genetic counselors due to geographical and other constraints. Dear students, let's now discuss about the history of genetic counseling. The practice of advising people about inherited traits began around the turn of the 20th century. Shortly after, William Bateson suggested that the new medical and biological study of heredity be called genetics. Heredity became intertwined with social reforms when the field of modern eugenics took form. Although initially well-intentioned, ultimately the movement had disastrous consequences. Many states in the United States had laws mandating the sterilization of certain individuals. Others were not allowed to immigrate, and by the 1930s, these ideas were accepted by many other countries, including in Germany, where euthanasia for the genetically defective was legalized in 1939. This part of the history of genetics is at the heart of the now non-directive approach to genetic counseling. Sheldon Clark Reed coined the term genetic counseling in 1947. Most of the early genetic counseling clinics were run by non-medical scientists or by those who were not experienced clinicians. With the growth in knowledge of genetic disorders and the appearance of medical genetics as a distinct specialty in the 1960s, genetic counseling progressively became medicalized, representing one of the key components of clinical genetics. It was not, though, until later that the importance of a firm psychological basis was recognized and became an essential part of genetic counseling. In 1979, the National Society of Genetic Counselors, that is NSGC, was founded and led by the first president, Audrey Hamler. Dear students, let's understand the role of genetic counseling. Genetic counselors help identify families at possible risk of a genetic condition by gathering and analyzing the family history and inheritance patterns and calculating chances of recurrence of a condition or disease or disorder in their family. They provide information about genetic testing and related procedures. They are trained to present complex and difficult to comprehend information about genetic risks, testing and diagnosis to families and patients. Genetic counselors can help families understand the significance of genetic conditions in relation to culture, personal and familial contexts. They also discuss available options and can provide referrals to educational services, advocacy and support groups, other health professionals, and community or state services. Genetic counselors can serve as a central resource of information about genetic conditions for other healthcare professionals, patients, and the public. Dear students, let's discuss about the detection and early processes. Diagnostic testing occurs when an individual is showing signs or symptoms associated with a specific condition. Genetic testing can be used to arrive at a definitive diagnosis in order to provide better prognosis as well as medical management or treatment options. Testing can reveal conditions that may be mild or asymptomatic with early treatment as opposed to debilitating without treatment, such as phenylketonuria. Genetic tests are available for a number of genetic conditions, including but not limited to Down syndrome, sickle cell disease, and muscular dystrophy. Establishing a genetic diagnosis can provide information to other at-risk individuals in the family. Any reproductive risks, for example, a chance to have a child with the same diagnosis, can also be explored after a diagnosis. Many disorders cannot occur unless both the mother and father pass on their genes, such as cystic fibrosis. This is known as autosomal recessive inheritance. Other autosomal dominant disease can be inherited from one parent, such as Huntington's disease and DiGeorge syndrome. Yet other genetic disorders are caused by an error or mutation occurring during the cell division process that's aneuploidy and are not hereditary. Screening tests are often used prior to diagnostic testing, designed to separate people according to a fixed characteristic or property with the intention of detecting early evidence of disease. For example, if a screening test during a pregnancy, such as maternal blood screening or ultrasound, reveals a risk of a health issue or genetic condition, patients are encouraged to receive genetic counseling to learn additional information regarding the suspected condition. A discussion of the management therapy and treatments available for the condition may take place. The next step may differ depending on the severity of the condition and range from during pregnancy to after delivery. Patients may decline additional screening and testing, elect to proceed to diagnostic testing, or pursue further screening tests to refine the risk of during the pregnancy. Presymptomatic or predictive testing occurs when an individual knows of a specific diagnosis that is typically adult onset in their family and has other affected relatives, but that themselves do not manifest any clinical findings at the time when they seek testing. The decision about whether or not to proceed with presymptomatic testing should entail a thoughtful approach and consideration of various medical, reproductive, social, insurance, and financial factors with no right or wrong answer. Availability of treatment and medical management options for each specific diagnosis, as well as the genetics and inheritance patterns of the particular condition, should be reviewed, as inherited conditions can have reduced penetrance. Dear students, let's now talk about the approach and session overview. Approach in genetic counseling. There are different approaches to genetic counseling. The reciprocal engagement model of genetic counseling practice includes tenets, goals, strategies, and behaviors for addressing patients' genetic concerns. Some counselors favor a psychoeducational approach, while others incorporate more psychotherapeutic techniques. Genetic counseling is psychoeducational, as patients learn how genetics contributes to their health risks and then process what this means and how it feels. Whether the process of genetic counseling is a form of psychotherapy is up for debate. The relationship between the client and the counselor is similar, as are the goals of a session. As a psychotherapist aims to help his client improve his well-being, a genetic counselor also helps his client to address a situational health threat that similarly threatens client's well-being. Dear students, let's now discuss the structure of genetic counseling. The goals of genetic counseling are to increase understanding of genetic diseases, discuss disease management options, and explain the risks and benefits of testing. Counseling sessions focus on giving vital, unbiased information and non-directive assistance in the patient's decision-making process. Dear students, let's now talk about support during genetic counseling. Genetic counselors provide supportive counseling to families, serve as patient advocates, and refer individuals and families to community or state supportive services. They serve as educators and resource people for other healthcare professionals and for the general public. Many engage in research activities related to the field of medical genetics and genetic counseling. When communicating increased risk, counselors anticipate the likely distress and prepare patients for the results. Counselors help clients cope with and adapt to the emotional, psychological, medical, social, and economic consequences of the test results. After counseling for other hereditary conditions, the patient may be presented with the option of having genetic testing. In some circumstances, no genetic testing is indicated. Other times, it may be useful to begin the testing process with an affected family member. The genetic counselor also reviews the advantages and disadvantages of genetic testing with the patient. Dear students, let's discuss about the outcomes of genetic counseling. The most commonly measured genetic counseling outcomes include knowledge, anxiety or distress, satisfaction, perceived risk, genetic testing, health behaviors, and decisional conflict. Studies suggest that genetic counseling can lead to increased knowledge, perceived personal control, positive health behaviors, and improved risk perception accuracy, as well as decrease in anxiety, cancer-related worry, and decisional conflict. Dear students, let's discuss about the subspecialties of genetic counseling. Let's first the adult genetics. Adult or general genetics clinics serve patients who are diagnosed with genetic condition that begin to show signs or symptoms in adulthood. Many genetic conditions have varying ages of onset, ranging from an infantile form to an adult form. Genetic counseling can facilitate the decision-making process by providing the patient family with education about the genetic condition as well as the medical management options available to individuals at risk of developing the condition. Having the genetic information of other members of the family opens the door to asking important questions about the pattern of inheritance of specific disease-causing mutations. Whilst there is a wealth of literature that describes how families communicate information surrounding single genes, there is a very little which explores the experience of communication about family genomes. Adult onset disorders may overlap multiple specialties. Dear students, let's understand the cardiovascular genetics. A rapidly expanding field in genetic counseling is cardiovascular genetics. More than 1 in 200 people have an inherited cardiovascular disease. Hereditary cardiac conditions range from common disease such as high cholesterol and coronary artery disease to rare disease like hypertrophic cardiomyopathy and vascular disease. Genetic counselors who specialize in cardiovascular disease have developed skills specific to the management of counseling for genetic cardiovascular disorders and practice in both the pediatric and adult setting. Cardiovascular genetic counselors are also integral in local and national efforts to prevent sudden cardiac death, which is the leading cause of sudden death in young people. This is done by identifying patients with known or suspected heritable cardiovascular diseases and promoting cascade family screening or testing of at-risk relatives. Common referral reasons include cardiomyopathy, including hypertrophic cardiomyopathy and familial idiopathic, that is dilated cardiomyopathy. Vascular disease include Marfan syndrome and aortic aneurysm or dissection. Congenital heart defects include the conotruncal defects, left ventricular outflow tract defects, etc. Familial hypercholesteremia is another condition. Family history of unexplained sudden death is the another one. Dear students, let's now discuss about the hereditary cancer genetics. Cancer genetic counselors see individuals with a personal diagnosis or family history of cancer or symptoms of an inherited cancer syndrome. Genetic counselors take a family history and assess for hereditary risk or risk that can be passed down from generation to generation. If indicated, they can coordinate genetic testing, typically via blood or saliva sample, to evaluate for hereditary cancer risk. Personalized medical management and cancer screening recommendations can be provided based on results of genetic testing or the family history of cancer. While most cancers are sporadic, not inherited, some are more likely to have a hereditary factor, particularly when occurring at young age or when clustering in families. These include common cancers such as breast cancer, while the BRCA1 or BRCA2 mutations can be there, ovarian cancer, colon cancer, and uterine cancers, as well as rare tumor types. General referral indications can include, but are not limited to, personal or family history of cancer with unusually young age of onset, that is, example, breast cancer under age 45, colon cancer under age 50. Diagnosis of a tumor or cancer with a high likelihood to be hereditary, that is, male breast cancer, ovarian cancer, metastatic or high-grade prostate cancer, pancreatic cancer, retinoblastoma, or pheochromocytoma or paraganglioma. Personal or family history of bilateral cancers, for example, both breasts and both kidneys, or multiple primary tumors in one person. Features associated with an inherited cancer syndrome, for example, more than 10 adenomatous polyps, rare types of gastrointestinal polyps such as hematomatous polyps. Family history of related cancers like clustered on the same side of the family, example, breast cancer, ovarian cancer, colon cancer, uterine, sarcoma or leukemia, or brain cancer. Possible germline, that is, inherited genetic mutation suggested by tumor profile testing. Dear students, let's discuss about the pediatric genetics. Pediatric genetics counseling can be indicated for newborns, infants, children, and their families. General referral indications can include birth defects or multiple congenital anomalies like cleft lip, palate, heart defects, spina bifida, etc. Intellectual disability of unknown cause, learning disabilities, or autism. Sensory impairments, for that of vision and hearing. Metabolic disorders like phenylketonuria or galactosemia, inborn errors of metabolism. Known suspected genetic disorders like Down syndrome, cystic fibrosis, or muscular dystrophy. Primary immunodeficiency can be the other reason. Dear students, let's discuss about the scope of genetic counseling. From identification of disease to psychological support, a genetic counselor is required for every purpose as an empathic fellow passenger in this journey of overcoming the disease. However, if specifically stated, there are major areas of biomedical diagnostics where role of a genetic counselor is inevitable, like diseases or disorders caused due to chromosomal aberrations or point mutations. Broadly, major interventional areas could be cancer management, reproductive biology, newborn screening, and rare genetic disorders. Dear students, let's now conclude the lecture. Genetic counseling is the process of investigating individuals and families affected by or at risk of genetic disorders to help them understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. This field is considered necessary for the implementation of genomic medicine. The process integrates interpretation of family and medical histories to assess the chance of disease occurrence or recurrence. Education about inheritance, testing, management, prevention, and resources. Counseling to promote informed choices, adaptation to the risk or condition, and support in reaching out to relatives that are also at risk. An increase in genetic counseling outreach efforts are needed to intentionally extend opportunities to populations that have been historically underrepresented in the profession, to create a more diverse and inclusive workforce, and to access to services. Given the history of low engagement of underrepresented minority populations in both clinical genetic services and genetic research, both of these aspects will be challenged and must be addressed before the benefits of precision medicine will be fully realized. Dear students, it was all about today's lecture regarding genetic counseling. Hope you have understood it well. See you next time with a new topic. Till then, take care and goodbye.